Well, they're both caused by viruses. That's pretty obvious. They're both respiratory illnesses that are transmitted by respiratory droplets and also touching surfaces and come into your mouth and things like that. Symptom-wise, some of the similarities, you're talking cough, aches, sore throat, some GI symptoms, that sort of stuff. And the length of illness is similar, but there are some differences and some mild subtleties between the two, at least we think, going into this season of having both out there. Well, the main difference is if I'm going to walk into a room, an exam room, and think this patient has influenza, one of the big differences you're going to see is that the illness started like a Mack truck. It was right now, where COVID seems to be a little bit more indolent and a little slower to hit you. The body aches associated with influenza are pretty profound. The cough is really deep and harsh, and there's a lot of chest burning when you have that influenza type cough. And some of that, people have those symptoms with COVID, but those are probably going to be more of the hospitalized patients where we don't see them as often in the outpatient space. Well, beings are both viruses. We don't have any antibiotics. Those don't work against viruses. And so influenza has an antiviral medication that won't necessarily kill the virus, but it may reduce the severity or at least the length of time that you're ill by a little bit. And that can be done with a pill as an outpatient. And so we'll be using probably a fair amount of that this year, and probably more so than we have in previous years. The treatment for COVID, again a virus, has an antiviral, not necessarily approved, but used, not as an outpatient. We use that in the hospital. Everyone's heard about remdesivir. And so that is a hospital administered medication for some of the more severe patients. Take a lot of the dual infections away and some of the difficulty in teasing out the diagnoses. You can get both at the same time. I've seen it happen across the country in different areas.